If you are the lucky ones that stayed with us, I would like to thank you and congratulate you for your patience. My name is Šergu and I'm the sales director for various proton solutions in EMEA, which includes Russia. And I'm very happy to be with you with the Russian Federation, especially in the presence of such great partners that we have. And one of the best centers, proton therapy centers in the world, in person of Jordan. So thanks, it was such a great presentation. I finished this symposium by where we started, where Jean-Luc started earlier, which is the map of our proton therapy partners. You would have noticed, or maybe you know, that Varian has only joined the world of manufacturing proton systems during 2007. So we only have 13 years of background. So we're not the biggest install base yet, but we are the fastest growing install base. And we have, or we're proud to call our partners so many of the luminary sites. So like the Christie in Manchester, UCLH in London, UPenn, where we have our speaker today, the New York Proton Center, which is a consortium of 3 major universities in New York, and so on and so forth. We're bringing proton therapy to new places, and proudly we were the first to take the modern proton therapy system into Russian Federation in St. Petersburg. So we have reached within the 13 years the ability to win about 50 to 60% of the market share every single year. And this is a bigger or better idea of how the market share or who the new partners or new clinical experts are choosing as their partners. So you would have seen that we have about 40% or 45% in the last 3 years. And that's in whatever measure you would like to make it. Because sometimes some companies or vendors choose to define market share in terms of rooms sold or systems sold or clinical systems handed over. Well, we win in all 3 categories, and those are the important categories. So I am here today to introduce you to that system that allowed this great expansion and this great revolution in proton therapy. The Varian ProBeam that is already existing in Russia, and its smaller brother, the Varian ProBeam 360, which comes with no clinical compromises. So it's smaller in terms of size. It is smaller in terms of cost compared to the old system that you can see here. So what you see here is the older gantry, and here you see the new gantry. But the cyclotron is exactly the same, and this is for the obvious reason that we didn't want to compromise the dose rate. So when we designed this system, we kept the clinicians in mind, so you, and we kept your patients in mind. This is also keeping in mind that a proton patient is usually a much more complicated patient than a photon patient. So I would like to ask you now a question. If I was to propose to you today a 180-degree rotational linear accelerator, how many of you would accept it from me? Nobody. I thought so. And that's similar in protons. We feel that it's the fact that some companies offer you as a half gantry 180 degrees or 200 degrees is really a compromise that is not fit to proton therapy and the efficiency and accuracy that you want to have with proton therapy. And that also applies to the fact that we offer you cyclotron, full-blown cyclotron, because while all the vendors in the market were trying to make proton therapy affordable, some of them concentrated on cutting the specs, like I said, for the gantry, or cutting the specs for the cyclotron and make it a synchrocyclotron. But then the future of proton therapy is flash, and that future is something we want you to keep with us. Also, we have the unique position of being able to offer you the software. You have seen a similar slide earlier. How many of you use today ARIA and Eclipse? Nobody? Well, one person? I'm sure more. Okay, so if you use ARIA and Eclipse, that's exactly what you would be using with proton therapy. You're already trained, and you're able to start right away. You're able to treat your patients faster. The workflow is exactly similar. I had a group this week earlier from the Russian Federation to visit our center in Denmark, and I asked them at the end, did you notice any difference in the workflow between proton and what you do today on your ProBeams? And the answer was no, it's exactly the same. And I said, yes, we made it that way so that it would be exactly the same, so that you would be able to treat your patients faster, which would mean also more patients that have access to proton therapy. That also comes the fact that we're the only company that can offer linear accelerators, proton therapy, and the software backbone for that means that you also have peace of mind in the future in terms of service, which is a very important matter when we talk about such a big investment, but also in terms of upgrades and new features. And so when you plan proton therapy, you're buying what you will be using 2 to 3 years from now, so the future is really the present, if it's in any field true. So we talked a lot today about FLASH therapy, and that's our one of the 5 pillars of the current future that we're working on. But there are other pillars that I would like to introduce you. Unfortunately, I don't have a lot of time to develop on each one of those, but I definitely would like to share with you a little bit of the idea on what we're working on. So, yes, we talked about FLASH therapy. I would like to remind everybody that all of our systems that exist today, all 26 of them, are FLASH capable, FLASH ready. So when FLASH becomes clinical, it would be a simple upgrade and without any major hardware changes. But we're also working on other things, like I said. So one of them is auto-planning and decision support. So one of the problems that a lot of people find when they start their proton center is there are not enough physicists to plan for this. There are not enough physicists with the ability to, or the knowledge and experience. And so what we thought about to do is create something called Rapid Plan for Proton Therapy. Basically, it's gathering a library of cases from the best centers in the world, from the UPenn, from PSI, from New York, and make an artificial intelligence system that once you feed it with your CT and contours, it gives you within 10 minutes or less a proton plan as good as 98% of those library cases. How does that help you? Well, one, instead of spending 10 hours to create a proton plan, you get one in 10 minutes. And then in many countries, especially in Europe, if you want to be reimbursed for proton therapy treatments, you have to have a proton therapy plan. And how, let's say, how boring would it be to spend your day as a physicist creating plans that will never be used? It will be sad. So we save you that hassle. We create the plans automatically. We also help you with that decision support. So if some of you are familiar with the Dutch model of comparing photon plans and proton plans and coming to a decision, which patient goes this way and which patient goes the other way, we can give you that decision automatically. The next pillar that I would like to introduce to you is proton SBRT, and I will try to be very quick on this because we have again a unique position of being a proton vendor on the hardware side and also on the software side, and that gives us more knowledge. So our system Eclipse knows the most about our ProBeam system, and it is able to do things that others could not, simply cannot, at the level of knowledge. One of them is what we call rapid scan, and that's the ability of checking or analyzing all the layers and spots. And instead of doing them one by one, what if there was an algorithm to find out a more optimal way to treat those spots? And that just by doing that, we can guarantee today, not 2 or 3, 5 years from now, that you can treat every single proton field in less than 5 seconds. And that's really revolutionary, because then you're able to treat those lung patients and those liver patients that you can't with any other vendor today on proton therapy. Next is online adaptive, and I think some of you, or probably all of you, know about Ethos. It's our new adaptive platform that has been introduced recently to the market, and the idea of that is to treat every single patient with adaptive in 15 minutes or less. And again, our unique position of being the only integrated vendor allows us to take those lessons that we learned developing Ethos, and well, it's not as simple as copy-paste, right, Bill? But we are able to do that quite faster than anybody else. And I hear a lot about proton arc, and that's one of the my last pillar that I would like to talk about, because in proton therapy we're a little bit behind you when it comes to arc therapy. So today, no patient worldwide is treated with arc therapy with a proton machine. No matter what anybody says, they may show you clinical plans, but they cannot show you treatments that they have done. So I can also show you a video of a patient with arc around them on a ProBeam. But that patient is not being treated, so I'll be honest with you. Why are we not treating today with arc? It's because we don't know yet what are the repercussions, let's say, of entry dose from from different angles with protons. So today we are physically able to do protons, but we're still working with the likes of UPenn to develop the models that allow us to plan for arc therapy on a proton machine. I can pretty much guarantee that by the time FLASH is around, which is soon, arc therapy on proton will be correct. So I know what we shared with you is a lot of nice visions, and some of it present, some of it you can have a vision for the future proton therapy center. And this is a vision. This is London 5 years ago. So the UCLH proton therapy center was supposed to be here, so -4 levels. We have a great location. There is a river here, a metro system here, so as difficult of a project as it can be. And that vision, to make it a reality, you need a really good team or partners that can make that happen and help you from the design phase to the installation phase, with the construction, with the installation, and make your project a success. And that's a real strong partner, a reliable partner, is what you need for a proton project. That makes the difference between treating your first patient within 2 to 3 years and waiting 7 to 10 years to treat your first patient. And that's who would be with you from day one, from when the politicians come and take the pictures, all the way to the hard work of treating the first patient. And we guarantee that if you can build in 12 months, we can install and commission with you in 12 months, and you have your first patient, your system ready for your first patient. So like I said, this is backed up by a lot of, by our experience in a lot of centers. We have reached 30 patients a day after just 6 weeks of opening Del Rey Medical Center in Florida. We have, with the New York Center, which is in New York City itself, about 70 patients in 3 months, and that's really unheard of. And so the ability of ramping up your patient volume isn't comes with a lot of hard work in the background. The service that Georgie talked about, the maintenance activities that take place at night, and a very strong training program for your end users. So with that, I would like to, well, maybe I'll go back to here and say, we can make it happen, and we would like to see it happen more often in the Russian Federation. So we thank you for your patience, and the whole group is open to your questions.